So my name is Nahreen Ahmed. I'm a pulmonary and critical care doctor based in the US, and I'm a humanitarian aid worker for the last 10 years working in crisis and conflict zones, including Gaza, Ukraine, Syria, Yemen, Sudan, and in various areas in sub-Saharan Africa as well. I studied in the US. I had undergraduate at Widener University. Then in medical school was Drexel University College of Medicine. And then I went on to do my residency at University of Illinois in Chicago. And then fellowship was in pulmonary and critical care in New York City at Bellevue. So in Gaza, there are many vulnerable people who were injured and have continued to be injured from missile strikes. The majority of the patients are children, and many of the children that we saw are under the age of 5. Typically, this is because they're so small that crush injuries are very deadly and fatal. They also suffer from significant malnutrition. Again, because they're quite vulnerable, that's a population that suffers from significant malnutrition. So we saw a combination, especially during the active part of the conflict. Most of the children were coming in from bomb blast injury, from drone attack or sniper injuries, so bullet wounds to the head, to the chest and body, many crush injuries, so children that look like they're sleeping but actually have a lot of internal bleeding, and that was the majority of the cause of death. Also, we are seeing a lot of communicable disease, such as infections, diarrheal infections, respiratory infections, things like this that are also affecting young children, who are, by and large, one of the larger population of victims in Gaza. I went to Gaza 4 times for a total of almost 4.5 months of time, cumulative. It's a very challenging place to work, and being in Bangladesh, when you hear about stories from what people experienced here during the Liberation War, many stories sound very similar, where war started and you were living in your home and you're hearing gunfire and missile strikes. We are working within a situation like that, and so when you're working, many doctors will tell you this, you try and block out everything from around you. And so you don't really feel fear. And as an international worker, we knew we were not the target, actually. The Palestinian doctors are the target. So unfortunately, that is the case, that the Israeli military is kind of directly targeting Palestinians. And so the only thing that kept us safe was being an international aid worker. But we did not really have any fear of being there, because mostly you're just focused on doing the work. I think the hardest part, of course, is seeing so many innocent people who were injured and killed, who continue to suffer. Every time I go, we see people living in tents. My Palestinian colleagues are living in tents. The doctors are living in tents. Their tents are flooding. They're coming to work with their scrubs are drenched. They have nowhere to dry their clothes. People are coming in with horrible infections, wound infections from their traumatic injuries. So even though there is a ceasefire right now, people are still dying from missile strikes in the safe zone of Gaza. So I think the hard part is it's very frustrating to witness this, to talk about it publicly, and still see that the world almost does not care or does not have the power to stop what's happening. So it's a very sad situation, it's a very frustrating situation, and hard to see our colleagues who will continue to be in a very bad situation there. I think most people probably have a good idea of my grandfather, Dr. Shamsuddin Ahmed, who was killed during the Liberation War. His story is very important to me because he is a healthcare worker who stayed behind in a hospital to provide care, and I think he knew probably that there was always a risk he would not come home. And yet he stayed in the hospital because he knew that the international law is not to kill doctors and nurses and healthcare providers, and that they should not be attacking hospitals. And even though that is the case, he was killed alongside with his colleagues and many others that day, April 9th in 1971. And that story is why I specifically go to conflict zones and advocate for the safety of healthcare workers and hospitals, especially during conflict. It is kind of what inspired me to go and work in these parts of the world, because they're often forgotten, and especially the need to speak about what's happening is very important. And this also came from my grandmother, my dadi, who was she was the first female principal of Sylhet Women's College, and was always a very big advocate for women's education. And her story is important to me as the other side of the advocacy work that I do, in that she used her platform in order to speak about the importance of education. And so in doing that, she was able to push for so many women to receive a proper education here in Sylhet, and her legacy lives on through many of us in our family who have chosen either service or education or something that is a mix of that as a part of what they do. Many of my cousins are either in the similar field, either teachers, maybe teaching in music, counselors working with children. We have many cousins who are doctors, nurses. And so I think everybody has adopted a little bit of their legacy into what we choose to do. I think most importantly for me, what I do in my humanitarian aid work is actually capacity building and training is a big part of my work. And so my wish for the Kidney Foundation Hospital is that it creates a platform and location for many people to come to be trained, to receive proper high quality care. What role I think I would like to play is mainly, I'm technically live in the US, so as an outsider. As a family member, we're very proud of the work that the family has done together. Our family in Sylhet, and my father and mother especially, and pupus, and chachu, and everybody, our parental generation has put in a lot of effort to make this happen. I think from our generation, we wish to hope that it continues, but I think making sure it continues even without us. That's the most important thing. The success of a project is always when it can continue without anyone else that founded the project. So that's my wish. With my background in critical care, I would like to hopefully help when it's possible and if needed to help build the emergency triage and ICU level care that we hope in the future will be, as the hospital grows, will be another addition to the hospital itself. But ultimately, I think the most important thing is that we find local capacity, local leadership that can take the hospital to the next level, because it has to be run and operated by those who are here in Sylhet for it to be successful. And so we look forward to identifying those local champions who can take the hospital to another level. আমি তো বাংলাদেশে প্রায় 10 বছরে, over 10 years I've been doing some work here and there. So always it's a part of my work and my passion and my personal history. Everything I learned about global health and working in a global environment I learned from Bangladesh, coming as a child and then coming here as a medical student and working at Dhaka Medical, and then coming back and creating a training system for ultrasound in the ICU at Dhaka Medical, and then remaining in touch with my colleagues there, and then working with BRAC and other organizations who work in Bangladesh. So for me, it's always important to stay involved, but I also recognize that in Bangladesh there is a vast amount of very intelligent and capable people. And I think that my hope and expectation for Bangladesh is that over time that these systems are in place to recognize a lot of the talent that exists in Bangladesh, to help foster that talent in any way we can from outside Bangladesh, and continue to grow homegrown the talent and intelligence and skill building here in Bangladesh, because I think it's a country of 160 million people. So the workforce is here. We have to figure out how to help and mobilize and improve the structure and systems for people here. But everything that Bangladesh needs is in Bangladesh. The people here are very, very capable. I'm always impressed, and I learn so much from everyone here. So my hope and wish is that the country continues to grow with all of the talent that's here. Yeah, and that we can help in any way. One of the things I learned from hearing about Bangladesh and the birth of Bangladesh at a young age, and then hearing stories from friends who are Bangladeshi, there is something we are seeing in the world right now where there is a lot of division. Division across religions, across countries and borders. But at the time of the birth of Bangladesh, you had Muslim families hiding Hindu families at their own risk to help them survive. And so the message I want to remind everybody is that there was a time when people of all religions were living very harmoniously, and those stories that we hear from our family about when it was like that, I would like for us all to remember that as we move forward, because hatred can be infectious, but even more so kindness, I think, can be even more infectious. And if we remember that and remember the stories of the past and the good parts of the stories of the past, I hope that the future can be more peaceful moving forward.